Good night. I'm going to talk about gynaecology, the female reproductive system, the womb, fallopian tube, vagina, neck of womb, and ovary. Menstruation. A period is the common name for a menstrual period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes. Mean LMP 2/52 ago means the last menstrual period was 2 weeks ago. A menstrual cycle or length and frequency of periods is usually written in the form 4/28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss, menorrhagia, often with the passage of clots, coagulate blood. The term period pains means dysmenorrhea or painful menstruation, the time when a woman stops menstruating, normally at about the age of 50. It's called the menopause or climacteric. In every English, it is known as the change of life or simple the change. Symptoms of the menopause include hot flushes, sudden sensation of heat, and night sweat. A gynecological consultation. A gynecologist is talking to a 30 years old man. Gynecologist. Are your periods regular? Patient. Yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last usually? 4 or 5 days. Would you say they are light or heavy? Light. Do you get clots? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color is it? White. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, the diaphragm, and the intrauterine device (IUD) or copper coil. Condoms are available for both men and women. Thank you. Now I am going to read the exercise. Write a simple English phrase for each of the medical terms below using your medical knowledge. Hysterectomy, an operation to remove the uterus. Menorrhagia, heavy or prolonged menstrual bleeding. Salpingitis, inflammation of the fallopian tubes. Cervical biopsy, a sample of tissue taken from the cervix for testing. Read the conversation between the gynecologist and the patient and complete the notes about the patient. Menarche at 13 years old. Menstrual cycle every 28 days. LMP last week. Menorrhagia, yes. Heavy periods. Dysmenorrhea, no. Discharge, no. No abnormal discharge. Now write the question that the doctor asked. Menarche. At what age did you have your first period? Menstrual cycle. How regular is your cycle? LMP. When was your last period? Menorrhagia. Are your periods heavy? Dysmenorrhea. Do you have any pain during your periods? Discharge. Have you noticed any abnormal vaginal discharge? Complete the case report. Case 15. A 45 years old woman had been having heavy periods lasting for 8 days with the passage of clots for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweat, and her general health had always been good. She had taken the contraceptive pill until a year previously, when a copper coil was fitted. She had had a normal pregnancy when she was 25. Thank you. Ahora voy a leer en español. Escribe una frase simple en inglés para cada término médico. Histerectomía, la operación para extirpar el útero. Menorragia, sangrado menstrual abundante o prolongado. Salpingitis, inflamación de las trompas de falopio. Y biopsia cervical, una toma de una muestra de tejidos del cuello uterino para su análisis. Okay. Lee la conversación entre el ginecólogo y una paciente y completa las notas del paciente. Menarquía, a los 13 años de edad. Ciclo menstrual, cada 28 días. LMP, última semana. LMP en las últimas semanas. Menorragia, sí. Menstruaciones abundantes, no. Flujo, sin flujo anormal. Ahora escribe las preguntas que haría el doctor. En la menarquía, ¿a qué edad tuviste tu primera menstruación? Ciclo menstrual, ¿qué tan regular es tu ciclo? LMP, ¿cuándo fue tu última menstruación? La menorragia, ¿tienes menstruaciones abundantes? Dismenorrea, ¿sientes algún dolor durante las menstruaciones? Y flujo, ¿has notado algún flujo anormal? Completa el caso. Caso 15. Una mujer de 15 años había estado teniendo menstruaciones abundantes de 8 días de duración, con coágulos durante 9 meses. No había sangrado entre menstruaciones ni después de las relaciones sexuales. Su menstruación no era especialmente dolorosa, no había notado sofocos ni sudores nocturnos, y su salud general siempre había sido buena. Había tomado la píldora anticonceptiva hasta hace un año, cuando le colocaron el dispositivo intrauterino de cobre. Tuvo un embarazo normal a los 25 años. Esto es.